Hello, and thank you for joining me for this COVID-19 presentation presented by the New York Immigration Coalition. My name is Lovelie Tejada. I'm the Manager of Community Engagement at the NYIC. Um, Typically, we do these sorts of presentations face-to-face, but obviously, um, due to the stay-at-home orders, we have transitioned our presentations to digital and virtual ways. So we will be doing these presentations moving forward through digital means, giving you some COVID updates, as well as a brief presentation on what public charge is, as well as an introduction to our hate crime violence presentation, and any details regarding how to stay in touch with us and get involved at the NYIC. So the New York Immigration Coalition is an umbrella policy and advocacy organization of more than 200 groups in New York State that work with immigrants and refugees. Our mission is to unite immigrants, members, and allies so all New Yorkers can thrive. We envision a New York State that's stronger because everyone is given the opportunity to pursue their dreams. Regarding health, New Yorkers looking for the most updated information regarding COVID-19 can text COVID or COVID ESP for Spanish to 692-692 or call the New York State Department of Health's coronavirus hotline at 1-888-364-3065. New Yorkers who are experiencing fever, cough, shortness of breath, or other cold or flu-like symptoms and do not feel better after 3 to 4 days should consult medical help by telephone. If you need help getting care in New York City, call New York City Health and Hospitals directly at 844-692-4692. If you need help getting care elsewhere outside of New York City in New York State, call the New York State COVID-19 hotline at 888-364-3065. Anyone who is low income can get free COVID-19 testing, evaluation, and treatment in New York State, regardless of their immigration status. Special enrollment for uninsured New Yorkers is now available as COVID-19 cases climb. Individuals can enroll through New York State of Health from now until June 15th. Call New York State of Health at 855-355-5777. This special enrollment period hopes to discourage individuals from avoiding COVID-19 testing or medical care for fear of the cost. All New Yorkers should consider themselves potentially exposed to the coronavirus. That means that everyone should stay home as much as possible, even if they do not have symptoms at the time. While at home, all New Yorkers should self-monitor. Self-monitoring means that you check yourself for fever and remain alert for cough, shortness of breath, or sore throat. It's really important that people who have these symptoms stay at home, do not attend work, school, public events, or group gatherings. Public charge and COVID-19. So we wanted to go over the perceived implications of seeking out COVID-19 testing and treatment on your potential public charge determination. So USCIS announced that receiving treatment or testing for coronavirus will not be used in any future public charge analysis. Immigrant families should seek the care they need during this difficult time. It is safe and smart to see the doctor if you need care. We all play an important role in keeping our communities safe and healthy. Your doctor is required to honor your right to privacy. You do not need to share any information about your immigration status unless you apply for Medicaid or other health coverage. You can still see a doctor without health insurance. This includes care you receive in any emergency room at community health centers, free clinics, and public hospitals. Other family members' use of public benefits will not affect an immigrant's green card application. There is no benefit to disenrolling U.S. citizens or other eligible family members from health and nutrition programs. Public charge does not apply to all immigrants. To learn more about who is affected by the rule, please visit our website, NYIC.org. Most health and nutrition programs are not included in the public charge test and are safe to use. The benefits that are not part of the public charge test rule include emergency Medicaid, disaster assistance, New York State Medicaid, disaster SNAP, H&H options, Children's Health Insurance Program, or CHIP, Medicare, food banks, homeless shelters, child care related services, sliding fee scales, or charity care at hospitals and clinics, Special Supplemental Nutrition Program for Women, Infants, and Children, or WIC. Education. All New York City schools will remain closed through the end of the school year. New York City students are now expected to participate in remote learning. Over 400 New York City school locations will be serving free grab-and-go meals for anyone Monday through Friday from 7:30 a.m. until 1:30 p.m. and will have 3 meals per person available every day during the week. New Yorkers can find the closest location serving meals here at this link. Families without computers, Wi-Fi, or with other technological needs should fill out this survey, which is now offered in 9 languages. The link is coronavirus.schools.nyc/remote learning devices. Please contact 718-935-5100 and click option 5, or call your school's principal if you have not received or filled out the technology survey. Families or advocates can call Devonte Graham at dgraham22@schools.nyc.gov to troubleshoot any issues regarding devices requested with the student's name, date of birth, and school name, and the OSIS number if they have it, or the name of the shelter they live in if it's applicable. Parents should also fill out this Survey Gizmo survey to find out if they qualify for childcare at this time. Now, education resources. Spectrum is offering free internet for 60 days to college students and households with K through 12 students that currently do not have internet. People behind on their Spectrum bill can get their internet service restored. Call 833-267-6094 for more details. Charter Cable will offer free Spectrum broadband and Wi-Fi access for 60 days to households with K through 12 and college students who do not already have a subscription. And installation fees will be waived for new student households. Call 844-488-8395. AT&T is also offering 60 days of free public service. Optimum will also restore internet services to families behind on payments. The New York City Department of Education has posted instructional resources for students in grades pre-K through 12 online at schools.nyc.gov/learn-at-home. More information about remote learning, meals, and other core services will be made available for families at schools.nyc.gov/coronavirus. Many adult education programs are still providing remote services. Please contact your individual program to find out what supports are being provided. Also, the Department of Education has 57 regional enrichment centers and child care sites open across the city for children of healthcare, emergency services, and transit workers, as well as grocery store, pharmacy, and food workers, including restaurant, takeout, and delivery workers. feeding staff, residential and commercial building staff, and other frontline workers, regardless of whether they go to public or private school. They will be open from 7:30 a.m. to 6 p.m. for children in 3K up to 12th grade. Immigration. As for the immigration courts, until May 15th, all non-detained hearings are canceled. New York City non-detained immigration courts, the locations including Broadway and Federal Plaza, are open for filing only until further notice. Varick, Buffalo, and Batavia are open for detained hearings and filings. Regarding UCIS, until June 4th, all appointments are canceled. This include fingerprint appointments and asylum interviews. Now regarding ICE, you should contact your local office to find out if you need to appear for a check-in, but it appears as though all in-person check-ins are canceled. Bond office is closed in New York City, and the closest office is in Newark. Batavia and Albany are open. Citizenship oath ceremonies are canceled, and immigration enforcement in the communities continues. Now regarding social services. All programs run by the Department for the Aging are closing and canceling all congregate meals, recreational and educational services and activities, effective immediately. Senior centers will operate strictly to deliver food to seniors. Call your local senior center or 212-244-6469 with questions. If you cannot leave your home to get food, do not have anyone who can bring you food, and you're not able to use private delivery options, you may be eligible to get meals delivered directly to your home. Go to nyc.gov/getfood. HRA benefit applications for food and utilities, as well as other forms of emergency assistance, are currently available online. Pending state approval, HRA will not take any adverse action on cases where clients are unable to keep their appointments. Congress recently made temporary changes to unemployment insurance that provide unemployment to individuals that previously have not been eligible. If you're unemployed or furloughed without pay and a US citizen or a non-citizen with work authorization, you can file a claim for unemployment through the Department of Labor website to see if you qualify. Small business owners can receive a list of services with resources and updates on loan and financial support programs in English at the SurveyMonkey link below. For more information on the city's response to COVID-19, please visit nyc.gov/coronavirus or call 311. I also want to add a few points. As of April 6, 2020, the Unified Court System implemented a virtual court model in all trial courts in each of New York State's counties to address essential court matters. Essential functions that will continue include proceedings on landlord lockouts, serious housing code violations, and repair orders. The housing courts are only hearing emergency applications where tenants have been locked out or evicted from their apartments and where serious conditions have gone unrepaired. If you are a NYCHA or Section 8 tenant and have lost income in your household, you can request a rent reduction by calling NYCHA Customer Contact Center at 718-707-7771 or through the online self-service portal. New York State will extend the moratorium on evictions for those facing COVID-related hardship until August 20th. The state will ban late fees and missed payment fees during the eviction moratorium period. Renters will also be able to use their security deposit as a payment and repay the deposit fee over time. Census and voting. On May 5th, a federal judge ordered election officials in New York State to hold its Democratic primary election in June and reinstate all qualifying candidates on the ballot. The primary will still occur on June 23rd, 2020, and the general election on November 3rd, 2020. Early voting is scheduled to begin June 13th and run through the 21st. New York will be mailing postage-paid absentee ballot applications to all voters based on the address at which you're registered. If you wish to vote by mail, return the application and you'll be mailed a ballot. If you do not receive the absentee application in the mail, applications can be downloaded on the State Board of Elections website at elections.ny.gov/votingabsentee.html. If you live in New York City, you can also request a ballot by calling 866-868-3692. The deadline for census self-response online, by phone, or by returning the paper questionnaire has been extended to August 14th. Census forms can be completed online at my2020census.gov or by phone at 844-330-2020. For language support completing the census, you can visit 2020census.gov/en/languages.html. If you're having trouble completing the census or have any questions, you can also call a number of hotlines that serve your specific language needs. So here are a list of 4 organizations with their specific communities that they serve and their respective phone numbers. So the Arab American Institute can be contacted at 833-333-6864. The Asian Americans Advancing Justice can be contacted at 844-2020-74. Lawyers Committee for Civil Rights can be contacted at 888-268-6820. And Naleo Educational Fund can be contacted at 877-352-3676. Domestic violence. Avoiding public spaces and working remotely can help to reduce the spread of COVID-19, but for many survivors, staying home may not be the safest option. We know that any external factors that add stress and financial strain can negatively impact survivors and create circumstances where their safety is further compromised. Abuse is about power and control. When survivors are forced to stay in the home or in close proximity to their abuser more frequently, an abuser can use any tool to exert control over their victim, including a national health concern such as COVID-19. In a time where companies may be encouraging that their employees work remotely and the CDC is encouraging social distancing, an abuser may take advantage of an already stressful situation to gain more control. Here's how COVID-19 could uniquely impact intimate partner violence survivors. Abusive partners may withhold necessary items, such as hand sanitizer or disinfectants. Abusive partners may share misinformation about the pandemic to control or frighten survivors or to prevent them from seeking appropriate medical attention if they have symptoms. Abusive partners may withhold insurance cards, threaten to cancel insurance, or prevent survivors from seeking medical attention if they need it. Programs that serve survivors may be significantly impacted. Shelters may be full or may stop taking intakes altogether. Survivors may also fear entering shelter because of being in close proximity to others or in groups of people. Survivors who are older or have chronic heart or lung conditions may be at increased risk in public places where they would typically get support, like shelters, counseling centers, or courthouses. Travel restrictions may impact the survivor's escape or safety plan. It may not be safe for them to use public transportation or to fly. An abusive partner may feel more justified and escalate their isolation tactics. For any victims and survivors who need support, you can call the National Domestic Violence Hotline at 1-800-799-7233. Or if you're unable to speak safely, you can log on to thehotline.org or text LOVEIS LOVEIS, to the number 22522. Mental health. An infectious illness outbreak such as the coronavirus can be stressful to you, your loved ones, and your friends. It is natural to feel overwhelmed, sad, anxious, and afraid, or to experience other symptoms of stress, such as trouble sleeping. To reduce your stress and to manage the situation more resiliently, try to remain positive, remind yourself of your strengths, connect with friends and loved ones, and use healthy coping mechanisms. NYC Well is a service that provides crisis counseling, peer support, short-term counseling, mobile crisis teams, as well as connections to ongoing mental health and substance misuse services. Their website offers a number of well-being and emotional support apps that can help you cope. If your symptoms of stress become overwhelming, reach out for support and help. You can contact NYC Well, a confidential helpline for mental health and substance misuse services, where trained counselors can provide you with support 24/7 in over 200 languages. Call 888-692-9355, or you can text WELL, WELL, to the number 65173, or visit on the web nyc.gov/NYC Well. The New York State Office of Mental Health Emotional Support Line also provides free and confidential support, helping callers experiencing increased anxiety due to the coronavirus emergency. The helpline is staffed by volunteers, including mental health professionals who have received training in crisis counseling. OMH support line is 844-863-9314. Food pantries. In light of ongoing developments around COVID-19, many emergency food providers have temporarily suspended normal operations. We encourage you to call ahead to confirm services and hours. You can learn more about the Food Bank's COVID-19 response at foodbanknyc.org/get-help. The sites listed on the Food Bank's map located on their website have switched to grab and go to minimize the risk of exposure. If you're looking for food, please call your local bank, a food bank, in advance to ensure that they're open. You can call 212-566-7855. And we encourage staff, volunteers, and clients to follow the health recommendations from federal, state, and local officials when they contribute or receive services. What is public charge? Public charge is a test in immigration applications to see if someone is likely to become dependent on the government. Now, quickly, I just want to highlight that the key words there are in immigration applications, meaning that if you're not looking to adjust your immigration status, then you should not have any fear of having a potential public charge determination. You will not undergo a public charge test if you're not looking to adjust your immigration status, if you're not applying for an immigration status change. So how does the public charge test work? The public charge test involves looking at certain factors to decide if a person is likely to rely on government support in the future. So such factors include health, education and skills, employment, family size, income, and certain past public benefits used, right? So important to note here is that you could potentially be deemed a public charge regardless of whether or not you have used public benefits in the past. So if you, based on your education and your skills or your family size and your income, you could be deemed a public charge and never have used public benefits in the past. Public benefits in the new rule include cash assistance, for example, SSI, supplemental security income, TANF, or Temporary Assistance for Needy Families. 2, federally funded non-emergency Medicaid, but not healthcare services at a clinic, H&H options, the Essential Plan, emergency Medicaid, or Medicaid for pregnant women and children. 3, SNAP, food stamps. 4, Section 8 and Section 9 housing programs, such as NYCHA. So public benefits that are not part of the rule, which are far more than the public benefits that are in the rule, right? These are Special Supplemental Nutrition Program for Women, Infants, and Children, also known as WIC. Health insurance for pregnant women and children. Medicare, Essential Plan, Emergency Medicaid, state-funded Medicaid. School programs like lunches, buses, after-school programs, etc. Seeing a doctor at the hospital or clinic. Benefits used by an applicant's children and family members will not count in that person's public charge test. One thing to harp on here is the point I just made, right? If you are helping someone administer their own benefits, meaning that your child, for instance, may have some nutritional program, and the card is in their name, the program, the benefits is in their name, but you are going to the supermarket to help administer those services to that child, that will not be used against you. You are simply helping administer those services for your child or your family member who may not be able to go to the supermarket themselves, right? But the benefit is not in your name. It is in the child's name. It is in the other family member's name. You are simply helping administer. That is not going to be used against you. Along those lines, who does public charge apply to? So if you're applying for citizenship, you will not undergo a public charge test. Similarly, if you are in any of these categories, a refugee and asylee, you have a T visa, victim of trafficking. You have a U visa or a Bauer self-petitioner, victims of domestic violence or other serious crimes. You are a SIJ, a special immigrant juvenile, or some other immigrants. You will not undergo a public charge test. However, if you are applying for a green card and other visas, you are subject to a public charge test. Now, just to expand on that point, if you are applying from within the United States, the public charge test may apply to you. The previously mentioned public programs, the totality of your circumstances, and your sponsor's affidavit of support will be considered. If you're applying from outside of the United States, U.S. consular offices abroad use different roles in making a decision. So you should consult with an expert for advice on your case before making any decisions, like an immigration lawyer. I want to distinguish here the difference between an immigration lawyer and a private attorney, right? A private attorney may not have the expertise in immigration law in order to advise you on public charge and your use of benefits. So getting the help from an immigration attorney when it comes to this determination specifically is really helpful. Just to expand a little bit more on this point. Green card applications and some visa applications are the only time the public charge and admissibility test is applied. It does not apply when renewing DACA, for example, or when renewing a green card, or when applying for citizenship. If you have TPS and don't plan to apply for a green card because you are not eligible to, you do not need to be concerned with public charge. Immigration officials only apply the test while considering an application for a green card or visa, or when seeking to extend a non-immigrant visa like a student visa. Now, like I just mentioned, right? Green card holders have passed the public charge test. Now, things do change, however, if they leave the US for more than 180 days, because when they return, they may have to undergo a public charge test, meaning that if you are a green card holder and you are making plans to leave the country, make sure that your trip is fewer than 180 days in order to avoid the public charge test. The rule changes are not retroactive. The new rule changes can only be applied after February 24th, 2020. Applications filed prior to that effective date are not subject to the new rule, and use of the benefit programs in the new rule will only be considered after February 24th, 2020. If you have any questions regarding public charge, or if you need advice regarding where you can seek immigration legal help, please call the Office of New Americans hotline at 1-800-566-7636. The hotline is free, anonymous, and available in many languages. Now, quickly, I want to go over the City Council Hate Violence Prevention Initiative. Unfortunately, during COVID-19 and our stay-at-home order, we have seen a rise in the number of reports of hate crimes. We've seen a rise in attacks against immigrants, against those specifically those against our community members of Asian descent. So it is especially important right now for us to all be equipped with the information about how to report a hate crime, especially if we know someone who has been victim of a hate crime, or if we ourselves believe that we have been a victim of a hate crime. In 2019, the New York City Council developed the Hate Crime Prevention Initiative, a coalition of diverse community organizations designated by the council to improve education and services in the city to combat hate crimes in New York City. The New York Immigration Coalition is proud to be part of this initiative, educating our immigrant and refugee communities and empowering them to report these hate crimes. So we are looking to support and elevate this conversation and equip our most vulnerable communities about the definition of a bias-motivated incident and about how to report them. So what's a hate crime? A hate crime is an offense like vandalism, arson, assault, or murder motivated by bias. Hate crimes are motivated by bias, prejudice, or personal hatred toward the actual or perceived characteristics of a victim, including race, color, national origin, ancestry, religion, religious practice, age, disability, sexual orientation, gender, or gender identity. The type of conduct which will be considered as a hate crime is wide-ranging and includes verbal abuse, harassment. The list goes on, right? Throwing rubbish in a garden, abusive phone calls and text messages. So what do you do if you've been the victim of a hate crime? First, you should file a police report. Get the responding officer's name and badge number. Make sure that the officer files an incident report form and assigns a case number. If a police report is not taken at the time of your report, go to the police station and ask for one. Always get your own copy of the report, even of the preliminary report. And if you believe that the incident was bias motivated, urge them to mark hate or bias motivation or hate crime. After, notify your local community organization about the incident. This is especially important regarding seeking out resources for yourself, but also in order to determine whether or not this has become a trend in the neighborhood or in the area. Find support. Look to your friends, your family, get professional help, and again, seek out resources. So to that end, here are a number of hotline numbers that you can call. In New York City, you can call 911, the NYPD Hate Crimes Task Force, which can be contacted at 646-610-5267. The Public Advocate's Office that can be contacted at 212-669-7250. The New York District Attorney Office of Hate Crimes in Manhattan, it's 212-335-3100. In Brooklyn, 718-250-4949. You can also reach out to the New York City Human Rights Commission, 718-722-3131. Outside of New York City, you can reach out to Nassau County, 516-571-7756. Nassau County Crime Unit, 516-573-3330. Nassau PD Community Affairs Bias Crime Coordinator, 516-573-7360. And Orange County, 845-615-3640. All incidents of anti-Asian or anti-immigrant discrimination can be reported to 311 or the New York State Hate Crimes Task Force hotline at 888-392-3644. Lastly, I want to ask you all to remain engaged and remain involved with the NYIC. Right now, we're obviously ramping up the ways that we are staying engaged with you all, community members, families, digitally, right? So we send a number of alerts via text message. So if you want to subscribe to our text message service, please text us at NYIC to the number 52886 for English, or Acción to 52886 for Spanish, and you'll receive a number of our text alerts on our campaigns, on resources that we're sending out that you can find digitally, so that you can stay involved and be aware of the resources that we are providing for our community. So here are a few ways that we're providing resources right now. Our Key to the City program right now is providing Facebook Lives, where we are focusing on how to provide assistance to our community members. So if you go to Facebook and you go to the New York Immigration Coalition's account on Facebook, you can look at our upcoming events and look to see when our next event will be, and where we will be talking about how to provide more assistance to our community members. On our website, this link that you can see on the slide right here, the nyc.org link, this link will take you to our website page where you can find COVID-19 resources specifically. All of the information that I just mentioned during this presentation, you can find out on our COVID-19 community resource toolkit, plus many, many more ways for you to remain safe, and many more links and resources for you to get a mask if you're a business owner. If you're looking for the link for the unemployment benefits, you can find all of that on the toolkit, as well as one-pagers right here on that link. I hope that this information has been helpful to you all, that you will be sending this information and forwarding it to your families, your neighbors, your community members. Feel free to contact me at Tejada at NYIC.org. Again, thank you so much. My name is Lovelie Tejada, Manager of Community Engagement, and we really appreciate your time.